Good afternoon, and thank you for joining the Duke Initiative for Science and Society for our latest discussion in our Coronavirus Conversation series. We are delighted to co-host today with the Duke Law School's Wilson Center for Science and Justice, the Harvard University Petrie-Flom Center for Bioethics, the Stanford Center for Law and the Biosciences, the Yale School of Public Health, and the Marshall Project. My name is Sarah Rispin-Sedlak, and I'm the faculty lead for the Coronavirus Conversation series here at Science and Society. In a moment, I'll introduce the speakers and moderators for today's discussion, which will be examining how COVID-19 has been affecting incarcerated people in prisons and jails and their broader communities, and what can be done to improve the situation. But first, a few housekeeping notes. If you have any questions for our panelists, please use the Q&A function and we will redirect those questions to our moderator who will try to address as many as possible. If you happen to lose connection at any point during the event, you can rejoin by re-clicking on the link you received in your email earlier today. After the event, I invite you to visit the Science and Society website, scienceandsociety.duke.edu, to learn about our work and upcoming events. You should look soon for coronavirus conversations on topics such as vaccine trials and trust in government scientific agencies. While you're on the Science and Society website, we also invite you to learn more about our master's program, where our students and faculty go in depth on the very science, technology, and ethics issues that we've been discussing over the past 7 months in this coronavirus conversation series. Please allow me to introduce our panelists. Lauren Brinkley Rubenstein is an assistant professor of social medicine at the University of North Carolina School of Medicine. She co-leads the COVID Prison Project there, which investigates COVID-19 in prisons and recommends policies and procedures for addressing it. She has also co-authored a perspective piece in the Journal of the American Medical Association, looking at the ethics of conducting COVID-19 vaccine trials among incarcerated people and prison employees. Maria Morris is an attorney with the ACLU's National Prison Project, where she has long been involved in litigation over the rights of incarcerated individuals, including to advance their constitutional right to health care. She has been following the impact and spread of COVID in prisons around the country, looking at its effect on incarcerated individuals, staff, local care workers, and their broader communities. She's been involved in major litigation against prisons for their COVID-19 practices, including a lawsuit against the Federal Bureau of Prisons for conditions in the Butner, North Carolina Federal Prison Complex. Joe Neff is an investigative reporter for the Marshall Project who previously worked for the Raleigh News and Observer and the AP. Among many honors, which I don't need to go completely into, he was a John S. Knight Fellow at Stanford University and a Pulitzer Prize finalist in 2013 for a team project at the News and Observer on North Carolina hospital chains. Since the beginning of the pandemic, he has written over a dozen articles chronicling the effect of COVID-19 on incarcerated people, corrections officials' responses or lack thereof, and inequities in compassionate release for prisoners at risk of severe illness from COVID-19. He too has focused on conditions at the Butner, North Carolina Federal Prison Complex. And our moderator today is Professor Brandon Garrett, the L. Neil Williams Jr. Professor of Law at the Duke Law School, and the director of the Williams Center for Science and Justice. A leading scholar of criminal justice outcomes, evidence, and constitutional rights, his current research and teaching focuses on, among other things, constitutional rights and criminal justice policy. With that, I'll hand things over to Professor Garrett to begin the conversation.
Great, thank you so much, Sarah. It's a treat to collaborate with those of us at the Wilson Center with Science and Society and so many other wonderful co-sponsors on this event. And it's just amazing to be able to hear from Maria, from Lauren, from Joe about their work. And what I asked them to start by doing is to further introduce themselves and talk about how, basically what they do in their work. Joe is a journalist, Maria is a litigator, Lauren is a public health researcher, and why their work mattered early on as COVID began to hit correctional facilities, whether it's jails, prisons, and other types of facilities across the country earlier this year. And so perhaps, Lauren, you could start, and then Maria, and then Joe.
Sure. Thanks, Brandon. I'm trained as a community psychologist, so tend to think about societal issues using the framework of the social ecological model. So, for 10 or 15 years now, I've been really thinking about the health impact of incarceration and how incarceration is a social determinant of health, how it is a structural determinant of health, and how it cross-cuts really these ecological levels of society. And so, a lot of the focus of the study of incarceration is really on that individual level, thinking about behaviors, criminal risk, et cetera. And I really wanted to think about that in a more comprehensive way. And so I really see incarceration as cross-cutting across, impacting people, families, communities, society, and then really bounded by policy. And so that's really how my thinking is framed, relevant to incarceration and health in general, and is also how our group is thinking about the impact of COVID-19 in correctional facilities on people who are incarcerated and also staff that work in those communities, and then also thinking about the relationship between communities and neighborhoods and carceral facilities. Early in the pandemic in March or April, I think a lot of us that do this work really knew that this was going to hit hard in jails and prisons. And then sort of in the middle of the night thought I had was to see if there was anywhere that was really giving us any data relevant to what was happening. And that's how the COVID Prison Project was born. We started looking at North Carolina because of course we're here and I'm at UNC. And kind of to our surprise, we found that across the country, prisons in particular were giving us more data than they'd ever given us on health conditions relevant to people who are incarcerated and staff that worked in those settings. And so then we just started collecting it day to day. And now we've been doing that for the last 7 or 8 months and have a good understanding of daily incidents of COVID-19 and what it looks like over time. And now 53 prison systems and something like 70 jails are giving us almost daily data on number of cases, number of tests or number of people tested, and deaths for both staff and people who live in prisons and jails. And so that's what our group is doing. And we've been doing some preliminary analysis looking at what this looks like over time, how policies in different places are related to prevalence and incidence, and really trying to make the link between correctional health and public health, and really trying to underscore how public health systems should be working with correctional facilities. And really, this should be a comprehensive collaborative effort in which we're prioritizing decarceration and then also thinking about conditions of confinement that exacerbate risk.
Great. And over to you, Maria.
Hi, so I am a litigator with the National Prison Project at the ACLU, and I've been working on prison conditions work for about 15 years. When we began to see COVID coming down the pike in the early part of this year, we put together, we realized that one of the things that always happens when there is a natural disaster or any other kind of disaster is that prisons and jails tend to get forgotten about. So we immediately started sounding the alarm that it was going to be really important to think through how prisons and jails dealt with this illness, because there's so many factors about the way prisons and jails function that just made it almost a certainty that what has happened would happen, which is that once that the virus would get into those facilities, and once it did, it would tear through them, doing terrible harm. As the months wore on, we have been litigating. There have been some successes, but they haven't been great for the most part. Certainly, the appellate courts have not been very receptive to these cases, and the trial courts it's been mixed. But what we've seen, the conditions that we've seen have been really atrocious. Separate from COVID particularly, prisons and jails have problems of being crowded and having not very good medical care to begin with, and having a high population of people who have the very types of vulnerabilities that have been recognized as being the things that are more likely to result in serious cases of COVID-19 and hospitalization and death. There's very high levels of diabetes and hypertension and lung diseases and people with transplants. These are all very common in prisons and jails. And then you add on top of that, that prisons and jails don't tend to be the cleanest of places. And there's also just a lack of concern. So you see a lot of, even once there is a policy that people should wear masks, you see a lot of people, both staff and incarcerated people, not wearing their mask or not wearing them consistently or not wearing them so that they cover both their nose and mouth. Also, the incarcerated people tend to have really poor quality masks, and they basically need to be wearing them all the time to be protected. And I think we've probably all grown accustomed to wearing masks, but it's hard. It's like, it's hard to do it for a long time. And most of us don't have to do it 24/7. But they're also not being given a lot of masks. So the masks get dirty and they get torn. They don't fit well. So all of these problems just compound the problems. And then there's very little testing in most prisons and jails. Obviously there's a wide variety of strategies, but as a general matter, there is not a lot of testing. It tends to be when people actually get sick, or if they are having to go somewhere other than the prison. Like if they have to go to the hospital for some particular reason or to a doctor's office for some reason, they may get tested at that point. But generally there's not a lot of testing going on. So while we know that there's a bad problem in the prisons and jails, we don't know how bad it is, because generally what's being reported is the number of positive tests, and a lot of people are not getting tested. And then they're also not doing a good job of quarantining or isolating people. If they do have contact, there's almost no quarantining just based on close contacts. And when people are isolated, they tend to be isolated in solitary confinement units, which carry their own risks as well. So with that overview of what's going on, I will cede the microphone.
Hi, I'm Joe Neff. I'm a news reporter. I work at the Marshall Project. We're an online newsroom, and we cover the criminal legal system, and we cover immigration, which is kind of a parallel criminal legal system. And I'm an investigative reporter, and I think that the way I view news, there's an apocryphal quote from Lord Northcliffe, an early 1900s media baron, who said, allegedly, news is something that someone somewhere wants to suppress. All the rest is advertising. And so I think that that's what I view my job as, trying to get at what's being hidden or what's being suppressed. And that's usually by people in power or authority. I'm not a believer in punching down, so trying to punch up. Before the pandemic started, I was working on a series of stories and conditions in Mississippi prisons, which are pretty horrendous. And when the pandemic came, everyone at the Marshall Project knew that it was going to hit really terribly. Inside of jails, inside of prisons, inside of halfway houses. The first story, I remember, is in the middle of March. Here in North Carolina, where I live, the prison system had shut down all visitation. So families, lawyers could not get in, and families couldn't see their loved ones, lawyers couldn't see their clients, but the state was still sending out workers on work release. So sending people, trusting them to go out in society to do a job under minimal supervision and come back every night, which seemed to be kind of crazy because they're going to go out in society and bring COVID back in. And what I found most telling in talking with the prison officials about it, they said, well, we want to maintain relations and help our business partners. So I focused on a chicken plant, a Tyson chicken plant in Western North Carolina, in the town of Wilkesboro, where there's, I think, about 2,000 employees there. And so there's a lot of prisoners going out and working there. And I wrote the story, and a few days later, they shut down the work release program, which I thought was, later, a month later, there was a huge outbreak in this chicken plant, and there were 500-600 people at this factory who tested positive for COVID, and they had to shut down the factory and clean it. It's back open now. But to me, it was very telling how we don't want visitors or lawyers to come in, but we'll still send prisoners out to these jobs, even at risk. And so that's been kind of the indifference to the safety of the prisoners has been, whether in jail or prison, has been kind of a constant for me throughout my line of reporting.
Great. Let's turn towards your work as the pandemic started to really aggressively spread. After, many of you, all of us, were delivering early warnings that this was a disaster waiting to happen, and then it really started to happening. So maybe you could give it just sort of a snapshot of your work, your thinking by the summer, as it became clear that very little was being done and matters were becoming more urgent. Do you want to start us off, Lauren?
Sure. Yeah, so I think in the summer, it was very clear, at that time, there had been major outbreaks across the country in various prison and jail settings. And, at that point, 9 of the 10 largest single-site cluster outbreaks were in prisons and jails. Those numbers, continue to kind of look that same way. Now we have universities that are in that those top outbreaks, but still many of the largest ones remain to be jails and prisons. And so it was clear, if it wasn't clear at the beginning, it certainly was clear in the summer that this was a major issue. Maria talked about testing. We did start to see in the summer some action around testing. It has never been adequate, and it still remains inadequate. But at that time, we started to see some, one-time mass testing take place across systems. Sometimes that was as a result of some of the pressure that folks on this panel, put on various systems, or the media, lawsuits that were working their way through the courts. Advocates really saying we've got to do more in these settings, and so we did see. In systems that, we might think it's counterintuitive for them to go first. One of the first systems that did that was the state of Texas. But it actually was a little bit of a, red herring, because what they did was they did this one-time mass testing to appease some of the folks who were speaking out against the inaction. But we still, to this date, really haven't seen any long-term testing plans be put into place by a majority of places. But we did, sort of start to see some movement on testing. The other thing that we started to see is some federal legislation that was being contemplated around standards for data transparency, and for the Federal Bureau of Prisons, that Senator Warren in particular has started to put forward some legislation that started in the summer, and our group started working with them to try to craft and optimize some of that. And so I think one of the questions that came through was, if we saw a change in the administration, what might that mean? And I think that there might be some federal legislation that could be very helpful as we move forward. But I would say, things have been kind of slow going. There hasn't been that much change. There was a lot of attention in the media on this, and then that kind of went away as other sort of crisis happened in the country. And so, I would say in the summer is maybe the height of some of the attention and some of the changes that were going to be made, but most of them were sort of temporary and not terribly effective.
Great. And turning to you, Maria, how is litigation going by midsummer?
So by midsummer, it was becoming clear that very few judges had an appetite for broad releases of people from the prisons and even from the jails. There had been some movement, particularly with jails, of trying to bring their population down somewhat by limiting the number of people they were bringing in. But as Lauren was saying, as the attention started waning, you'd see those jail populations ticking back up. So a lot of the focus has become more on trying to improve the conditions, with an understanding that if prisons and jails are not able to improve the conditions, there may be more space for pushing for releases subsequently. I think that a big part of the problem is just time. In order to get things done for prisoners in the legal system, you have to show deliberate indifference, which you have to show that the prison or jail was deliberately indifferent, which means there was a big risk and they didn't respond well to it, basically. And it's just, I think it's a very hard thing for a court to say you didn't respond well enough when you're talking about a really short period of time. I don't think that's necessarily appropriate that they don't, but I think that's a way that a lot of the courts are feeling, that, everybody is responding on the fly to this. And so how can we hold these institutions liable for also responding on the fly? I think, though, that a very unfortunate thing that we were seeing was that a lot of courts were saying, well, they did something, and so it's fine, which is not the legal standard at all. It just isn't. They need to address the risk, and we saw that they were not addressing the risks. So we are still pushing forward litigation, trying to keep pressure on, both through the media, but also in the litigation itself. Like many defendants, prisons and jails tend to act a little bit better when there is someone looking at them. So we are trying to keep scrutiny from the public and from the courts on the prisons and jails. One thing I wanted to add in about the one-time testing that we've seen a fair bit of, and it's something that happened at locally to Duke at Butner, the federal prison at Butner. They did in May, in one of the parts of the prison. It's a prison complex, and they have four identified facilities, one of them being a low security facility. And at the low security facility in May, they were having a really terrible outbreak. And numerous people died at that one facility in May. And so on June 1st, they decided to do a round of mass testing of everybody at this one facility at Butner. Unfortunately, they didn't do anything with the test results until about June 10th. So a lot of people are sick. Everybody gets tested. They start reporting publicly the test results over the next 10 days. You can see the test results of positive tests jumping by 200 people a day. And ultimately they said, I think it got to a little over 600 people in that facility of 1,100 people tested positive. And then they divided them up into housing units by whether or not they were positive or negative, whether or not they had tested positive or negative 10 days earlier, even though they had all been in close contact with each other that whole time. People who developed symptoms during that interval from the 1st to the 10th, but tested negative, were placed in the negative units. So you can see how nice that they did the testing, but it didn't really have the impact that it could have if they had been able to act upon it in a timely way.
Can I add to that, Brandon? Sorry, Joe. I'll be really brief, but that's such a great point. At Butner, I think 6 people died in 8 days, in it was an extreme outbreak with severe consequences. And in those early days, one of the bigger issues was the really big lag time in results. So, you'd have to send it off to a lab that was already backed up. We've heard reports of labs deprioritizing specimens from certain types of settings like prisons and jails. And so it took extra long, for these settings to get results back. And, I think such a big issue too is capacity to engage in quarantine and medical isolation and understanding the difference between those, and also doing contact tracing, right? So, all of these issues that, we maybe haven't mastered in the community in general, they're so much worse in these settings. And Butner's such a devastating example of just what that looks like when there is this kind of inaction and confusion.
Yeah. Also on the point of testing, we wrote stories about when prisons did mass testing, they found mass infection. And but in general, I would agree that prison wardens, prison commissioners have been really slow to test, and it's almost like they don't want to know what's going on in their facilities. And I think there's a real reason for that, which is, makes total sense, but it's not good for public health. But that is the crisis of short staffing in prisons all around the country. In North Carolina, the state where I'm at, state prisons are like 25 to 30% understaffed. In Alabama and Mississippi, it's like 50% of the positions are filled. And so you have prison professionals who are charged with running these. And I truly believe that they don't want to know how infected the staff is, or they don't want to have to quarantine them. They don't want to scare any more employees away. And so we are really, that is a real managerial challenge to them. Of course, the way to, one of the ways to solve that would be sending people home. For example, people who are on work release are already trusted to go out into the community every day? Why do they need to come back into the prison? But there has been a real resistance, both in the state and federal system, to let people out. We recently got the numbers for the first 3 months of the pandemic, March, April, and May, from the US Bureau of Prisons on applications for compassionate release, where a prisoner will go and ask the warden, I'm old, I'm sick, I don't have much time left on my sentence, please send me home. And so in those 3 months, there were 10,940 people who applied for compassionate release. Of those, the warden approved 156, which is less than 1.5%. All the rest were denied or ignored. And then of those 156 who were approved, 84 went to the Bureau of Prisons headquarters. And they denied 73 of those 84. So at the headquarters, you end up with they're approving 11 of the almost 11,000 people who applied. So one advocate just summed it up as, jailers got to jail. So there is a real resistance to letting folks out.
I'm thinking we should take questions. We have some.
Can I add something to what Joe was just talking about? There's in the Bureau of Prisons, there's also a separate process for getting people out of the prison facility. And so the compassionate release has to go through a court for each person. So it's much more likely to succeed if the Bureau of Prisons supports it. But then there was a separate process of transferring people to home confinement. And this was something that the Bureau of Prisons could do on its own. And back at the very beginning of the pandemic, Attorney General Barr told the Bureau of Prisons that they should be trying to transfer people to home confinement. So they would still be technically in Bureau of Prisons custody, but they would be serving out their time at home. And we have all heard various people who've gotten this, such as Michael Cohen, I believe Paul Manafort as well. But the idea was that you could get people out of this very dangerous situation if they were not people who posed a danger to society. Unfortunately, the Bureau of Prisons has been very slow to do this. It's used a lot of criteria that just exclude people from being considered eligible for this kind of transfer. And even when they sometimes they approve someone for several months hence. And so we had a client at Butner who was serving a 27-month sentence on a white collar crime. And he was approved, he had cancer. He was approved in late April for transfer to home confinement, but he was approved in late April for transfer to home confinement in August. He got sick and he passed away on July 3rd, a month and a half before he would have been transferred to home confinement. So I think that also shows the jailer's got to jail. Yeah.
If I could, Brandon, one point in there, I didn't mention that Maria's right. The home confinement has to go through a judge, and there have been about 1,600 people since the start of the pandemic who judges have ordered released. And the disparity about that is that it means that the prisoner has to have a lawyer, and for all intents and purposes, you need a lawyer to represent you, to get into court, to battle the Department of Justice attorneys. So judges have been letting people out, but there's a high bar to get into court.
I was wondering if you could speak briefly about, we've been talking about prisons, federal prisoners. If we could turn to jails for a moment, which, the bulk of any local jail population will typically be people who have not been convicted of any crime, innocent until proven guilty, and where stays, and Joe, you ran a wonderful story about this, the stays are often extremely short. So there's a lot of cycling to and from the community if people are only staying for a few days, a week, or be really interested in you sharing your views on the difference between how COVID has impacted jails and surrounding communities, since the population also younger than prison populations, but also so many people coming in and out.
Yeah, jails are different than prisons because people in prison tend to serve sentences of a year in years, and people who go to jail are usually just there for weeks or maybe months. So it's like we compared it to there's a cruise ship in every county in the United States. I mean, every county has a jail, and people are just cycling in and out of there. People being arrested, people who work there. And if COVID gets established there, then it spreads through the jail. So there has been a lot of community spread around jails. And it's one of the, I'm frustrated, it's one of the kind of an untold story just happening all over the country where we're having these outbreaks in jails. There's just one in a county in Georgia outside of Atlanta that just this week has got like, boom, 100 cases. Boom, I think it was 30 people on staff. And it's, and I believe that these type of outbreaks have just been popping up all around the country and largely often unseen and unreported on.
Yeah, I'll just add that, we have fairly okay data at the prison level, at the system level, mostly because they're giant and they're statewide. And so there's coordination of data. We know much less about what's happening in jails. Even some of the biggest jails in the country are not giving us much data at all. So we know COVID is in the building, in the many buildings, but not much reporting going on. And that's also the case in North Carolina. We know much less about the jails and actual case rates inside of them. There's a really great paper that was published in Health Affairs sometime in the summer that looked at jail churn and the association between jail churn and community spread, and showed it came from the Cook County Jail, one of the larger jails in America, and really showed that jail churn was associated with case rates both in Chicago and in the entire state. So really making the case for decarceration. At the beginning of the pandemic, Maria mentioned this before, but jails on average reduced their populations by about 30%, whereas prisons only did that by about 5%. But the bad news is that in more recent months, those numbers have ticked right back up to normal. So, jails, it's just as bad as it is in prisons, although we know much, much less.
We received a couple of questions looking more towards next year, I guess. If and when there's a vaccine for COVID, what are your thoughts on the degree to which people in prison or jails will get access to it? And if there is access to it, who, or what if prisoners refuse to take it?
Yeah.
Inmates refuse to take it? Presumably people will have some kind of a right to decide. Given the history of COVID testing, I suspect you're not going to say happy things about what might happen if and when there's a vaccine.
Yeah. So we're starting to think a lot about vaccines. And of course, some of the work that we're doing relevant to contact tracing and finding people is very applicable to vaccine administration, depending on how many doses of a vaccine you might need. We have a new grant in our lab that is focused on trying to characterize incidents in a number of really big prisons across the country. And as a part of that, we are working together with people who have previously been incarcerated to go into historical archives to try to understand all the missteps that have been made in previous pandemics, to bring that information forward and help inform best ethical guidance relevant to testing and then also vaccination. So, the piece that we wrote in JAMA that Sarah mentioned was really trying to make the case for centering people who are incarcerated and their voices in this conversation. Any decisions that we make around certainly clinical trials, which is like a whole nother topic that we don't have to get into, but like how implementation of these programs look and what is the best ethical pathway forward really has to rely on the expertise of people who live in these settings. And so I really think that's the biggest pitch we've really been trying to make, is that we need to bring those folks and have them sit at the table as experts to try to understand how this is going to work. And also, many lists have come out that, have people in different tiers of prioritization for vaccinations, and most of them don't include prisoners in that first tier, which I think is a giant mistake. And so I really think we ought to be advocating for having prisoners have the very first access to the vaccine when it finally comes out.
So we have a great group of questions all accumulating. A really important question is, okay, so we know that Black, Latinx, members of racial minorities in this country have disproportionately suffered under COVID. And we also know that similarly, our jails and prisons are disproportionately housing people of color, focusing specifically on, jails and prisons. The question is, what can we do given these failures to increase health equity? We have failures in society, but these are magnified in these correctional settings. What can we say? What can we do?
I have some thoughts and then I'll stop talking. So we've been collecting all these data across all these different systems. Only 4 states give us any data on race, and it's Tennessee, Massachusetts, Vermont, and Washington State. And none of the data, Vermont is the only one that's giving us comprehensive race data across testing and cases. Tennessee's giving us information on testing rates, but like 75% of the race is unknown. So the data we're getting is not very good. So I think that's a major gap in transparency. We do not know what the demographics of folks who are getting access to testing and then also being identified as having COVID. We don't know what that looks like. In Vermont and the other states where we have some understanding, we do see disparities. So we're seeing higher case rates among people of color when they're being tested. So, there are definitely disparities, and there's no doubt in my mind that incarceration, the carceral system in America, is driving some of the disparities that we also see in the community. So it's absolutely something that has not had enough attention and we don't know enough about, but we have to really advocate for more information.
Question for you, Maria, that came from the audience. I don't know whether in any of your litigation this has been so, but it's been remarkable for me to see that in some of these cases, there have been affidavits, declarations, efforts by corrections staff to join with plaintiffs, saying, look, our health is intimately connected with those for whom we work in these correctional settings. We're not given masks either. We're not given gloves either. And that you never see that, right, in corrections litigation. There's a larger question about, like, are staff given testing? Like, what have jails and prisons done for their staff? And I'm just interested in any remarks on this dynamic where staff are horribly affected by this too. They've joined in litigation in some of these cases.
So I think it's actually not as unusual as you might think. In the Plata overcrowding case from 2010 or so, the prison union actually joined in as an intervener on the side of the prisoners. And it makes sense. You're talking about health, and health impacts people who are near each other. The failure to be able to address infectious diseases and things that spread from person to person, those are going to have a really big impact on correctional staff and medical staff and administrative staff. All the staff in prisons are at risk. I wish that, nonetheless, I wish they were doing more of it, because they are very much at risk. In the Federal Bureau of Prisons, the Bureau of Prisons has decided not to test staff. They've said they can go get tested by their doctor and tell us whether or not they're sick. The Bureau of Prisons has had, I believe, 2 staff members die now. One of them at Butner. And prison workers, as a general matter, don't have great working conditions. They're, as Joe was talking about, they're very often, prisons are very understaffed, which means that people are working incredibly long hours in difficult conditions. They may be working multiple double shifts in a week. They are susceptible to all the things that everybody else is susceptible, and probably more so because they get run down because they're working really long hours. So I think it's important for staff to be protected. It's crucially important for staff to be protected and for them to be tested. And it's important for them to be tested so that they can protect themselves, but also for the sake of the people who are in the facilities, because those are the biggest vectors for disease coming in and out of the facility. They're the people who are coming and going every single day. So there's been some participation in these kinds of lawsuits by correctional officers. Honestly, I think there should be more.
What's your sense now, by the way, many months into this? I mean, some of the basic demands in these lawsuits that weren't asking for release, but were asking for changes in conditions, have been that, whether it's prisons or jails, make masks available, even the terrible kind, the cloth kind, the cheap kind, make gloves available to staff, and make, antiseptic alcohol-based hand sanitizer available, period. Make some more bars of soap available. Maybe put some tape on the floor to indicate distancing marks. My sense is that you still have entire prison systems in states, major jail facilities that aren't following even the most basic CDC guidelines that you'd have, in any public place. Is that still basically the case, or are there any good examples of jails or prisons that, my goodness, they're actually following public health recommendations now?
I would guess that there are some, and they're not generally going to get into the news. I think what most prisons and jails are doing is a little tiny bit. I think most places are generally making masks available at some level. It could be anywhere from fairly frequent distribution of masks to every 3 months you get a new one. So I think there's a wide variety of what they're doing on masks, but I think most prisons and jails have got some amount of masks available and encouragement of people to wear them. Almost none are making alcohol-based hand sanitizer available. A lot say that they are making soap available. I think it varies how available soap is. One of the things that we've heard about with the Bureau of Prisons is that they're using a particular type of disinfectant that they acknowledge requires being left on a surface for 10 minutes. But they never told the people who were doing the cleaning that they had to do that until sort of like late August. And you can imagine that most things, when they get cleaned in prisons, nobody's leaving a cleaning solution on for 10 minutes. And they're certainly not doing it on a phone between every person who wants to use the phone. So we've heard some about tape on the floor, or reduction in the number of chairs. We've also heard about that not happening until sometime in late August. We've heard about chairs being returned to rooms where they had previously been taken out. So I think some baby steps have been taken in most places, but far, far from what the CDC has recommended.
Yeah, so our group has also been tracking policies day over day in each of the prison systems in particular. And so as of yesterday, 82% of the 53 systems that we're tracking say they're providing masks to residents. 42% have required residents to wear those masks. 82% have provided masks to staff, and 68% have required staff to wear masks, but only 13 states have all 4 of those policies in place. And we can do that with we've been looking at that and with all of the different policies that have been, put in place over the last several months. But, one of the big caveats to these data are, sure, they're giving masks to staff, but are they actually wearing them? And so that's really the big unknown, is what does this actually look like in practice? And in a state like North Carolina, where we've got over 50 prison facilities, I'm sure that implementation looks very different across all of the different facilities. And so I think most of them have some policies in place, but I would be dubious, around how much are they being followed? I'm not sure.
Hey, Joe, in your reporting, have you come across evidence of policies that look okay on paper, at least to some extent, but that aren't being particularly followed?
Yeah, I hear that from both prisoners and from staff. For example, a senior officer in Texas was telling me that waiting, we're guaranteed a test, but then it took 2 weeks to get it, and then it took 12 days to get the results back. And though they say that they'll be distributing masks to staff and residents, that they're just not arriving at the prison. So I think that there's policy is one thing, but what's actually going on inside the prison or jail is it's safe to assume that it's not being followed carefully.
I mentioned to you before we began this event that I was reading the trial records from this case that went to trial in federal court in Texas regarding a geriatric facility, one of the 104 or whatever prisons in Texas. And the judge found that the warden staff were not credible when they claimed lots of different things, including that cleaning was being done adequately. And he credited the testimony of the people who were inmate janitors, who described how they were given detergent to last less than half the day. They'd be cleaning all day. They would kind of be mopping with water. And I mean, it was just amazing what they're describing in terms of non-compliance with whatever minimal rules were supposedly in place. We had a question, I think this one might go to you first, Maria, about the role of the Americans with Disabilities Act, which celebrated a big anniversary of its enactment. We have a Wilson Center event on that next week, this year, in this litigation. Since folks with disabilities are supposed to get reasonable accommodations, those rules do apply to correctional settings. What role have those claims played in this litigation? Has there been any effort by judges to take those claims seriously?
Okay, so There's been a lot of use of the Americans with Disabilities Act in these cases. And one of the important things to keep in mind about it is that the Americans with Disabilities Act, since the amendments of, I think, 2010, I think everything happened in 2010, includes a lot of medical conditions, as like where there is a problem with the functioning of some organ, for example. And what it means is that almost all of the categories that the CDC has identified as putting people at a higher risk, almost all of those are also disabilities under the Americans with Disabilities Act, or at least potentially are. And the Americans with Disabilities Act is a great law. And it's a lot clearer and more straightforward than constitutional law. It's much more cut and dry whether something violates the Americans with Disabilities Act than whether something violates the Eighth Amendment. And the argument that is being made is that the prisons have an affirmative obligation to make programs, benefits, and services, which everything in prison life is, available to people with disabilities on an equal basis with everyone else. So because I have severe heart problems, if that means that, for example, if I were to contract the virus, I'm 10 times more likely than my healthy young cellmate to die from the disease. So that means that if in order to get food, we have to line up, I have to take on a much bigger risk in order to get my food than my young, healthy cellmate does. So that's kind of the argument that we have been making. Hasn't gotten very far yet. Most of these cases are still in a very early stage. They've gone through preliminary injunction hearings or rulings, but they're moving forward. And I think the judges, for the most part, have been focused much more on the constitutional claims. I think that the ADA claims will make a bigger impact as the cases go forward and things are a little bit slower in the courts, so that the courts can actually start thinking more about, these are two separate claims, they have different standards, and how do I think about that? The one place where in the case in Texas, the court did find that there was an ADA problem with regard to people who have mobility impairments. So this is not the argument that's been being made most of the time with regard to the ADA, but the idea being that if you're in a wheelchair, you're picking up a lot of stuff on your hands as you push your wheelchair. And so you've got a higher risk as a result of that. And I think it was definitely not where I had been going when thinking about the ADA, but it makes sense. So we'll see how that proceeds.
Thank you so much. We could talk for hours, and I hope we can actually bring you back individually or together and keep talking about this, because there's a lot of work to do over the next weeks and months, and this problem, unfortunately, is not going to be going away anytime soon. and it's going to be affecting people in custody and people in our communities across the country. And so I just can't thank you enough for sharing your work with us. And I wish we had a lot more time, but let's stay in touch. We'd love to have you share more with our community here at Duke in the months ahead, because unfortunately this is not going away. Thank you all so much, those of you in the audience, and please join us for more of these conversations, and feel free to share more questions if we didn't manage to answer everything that you asked. Thank you so much.
Thank you.
Thank you. It's great to be here.